everyone, and welcome back to Clinical Cousins YouTube channel. Today we're going to go over the EKG findings that would indicate that our patient has left ventricular hypertrophy. I'm so excited to bring you this lecture today because eventually within seconds you're going to be able to take a look at an EKG and know if your patient meets the EKG criteria for left ventricular hypertrophy. So what is left ventricular hypertrophy, or LVH simply? It is an excessively large left ventricle. Now, why would we have a big muscle? Well, maybe the left ventricle has to push up against more weight. Remember, the left ventricle pushes blood through the body's systemic vasculature, which eventually ends up in the right atrium and right ventricle, but we must know that the left ventricle is under a lot of pressure. It has a lot of work to do. So what could cause our left ventricle to become so large? It could be due to excessive afterload, meaning that our left ventricle has to push blood against a lot of pressure. This is commonly called hypertension or high blood pressure. It is the pressure or afterload that the ventricle must overcome to eject blood into the aorta. So this excessive pressure could also be due to a closed or stenotic aortic valve, meaning that the left ventricle has to push blood through a cocktail straw rather than a normal milkshake straw. Or the problem could be due to excessive volume, such as aortic valve regurgitation, which would send blood back into the left ventricle after it has already been squeezed. Or it may even be mitral valve regurgitation, which would allow blood to be pushed into the left atrium when it is not supposed to. So there's a lot of complexity there, and we're not going to go into it in this video, but regardless of the cause, if our patient has a hypertrophied left ventricle, it means that they have generated more heart muscle to deal with the excessive work or strain that is placed on the ventricle. So we must remember a simple rule, that excessive muscle generates excessive electricity. This is what we can see on our EKG. Remember, our EKG is just measuring with little electrode eyeballs the electrical activity of the heart. So the phrase that we must remember is slur NEC, 1 AVL feet, all of these equal left hypertrophy. Again, slur NEC, 1 AVL feet, all of these equal left hypertrophy. So now we will break down these criteria to understand what they mean. If you memorize these criteria, you will be able to quickly assess if your patient has left ventricular hypertrophy. So let us make it simple to understand. So slur, SSLR, pronounced slur, means a septal S plus a lateral R is more than 35 millimeters, meaning that our septal leads, think leads 1 and 2. So our septal leads, our septal chest leads, and our lateral leads are V5 and V6. Remember, V5 and V6. So the patient will meet the criteria for LVH if we take the S from either V1 or V2 and we add it to the R from V5 or V6. And if these two heights equal 35 small squares or 35 millimeters, we say that this patient may have left ventricular hypertrophy. Now, NEC, meaning any chest lead, meaning V1 to V6, that has a amplitude greater than 45 millimeters will meet the criteria for left ventricular hypertrophy. Meaning that if you take any chest lead and the amplitude is greater than 45 millimeters, they will meet the criteria. Now, 1, we are looking at limb lead 1. So if the R wave in limb lead 1 is greater than or equal to 12 millimeters, we say that this patient meets criteria for left ventricular hypertrophy. Now, let's take a look at AVL. If the R wave, remember the tall R wave, in AVL is greater than 11 millimeters, we will say that the patient meets criteria for left ventricular hypertrophy. Now, lastly, AVF. This is our feet. AVF. If the R wave in AVF is greater than 20 millimeters, we will say that it is likely that our patient has left ventricular hypertrophy. Now, remember this saying, slur NEC, 1 AVL feet, all of these equal left hypertrophy, meaning left ventricular hypertrophy. So let's go over that one more time. What have we learned today? So I've drawn all the leads, I've drawn the heart here. We're going to analyze one by one so that we can commit these to memory. So follow along. So slur NEC, 1 AVL feet, all of these equal left hypertrophy. Slur, a septal S wave plus a lateral R wave, if it is greater than or equal to 35 millimeters, that person has left ventricular hypertrophy. Meaning, if we take the S wave from V1 or V2, the septal S wave, and we take the R wave from V5 or V6, remember, the lateral R wave. If you combine these two amplitudes, if you combine these two waves, and it is greater than or equal to 35 millimeters, it is likely that your patient has left ventricular hypertrophy. Now that's the most complex one, so let's take a look at the other ones. NEC, slur NEC. Remember, NEC, any chest lead, meaning V1, V2, 3, 4, 5, and 6, any chest lead that has a greater amplitude than 45 millimeters in total means that your patient likely has left ventricular hypertrophy. Now, 1, slur NEC, 1. The R wave in lead 1. If the R wave, remember the R wave in lead 1, if it is greater than or equal to 12 millimeters or 12 small squares, it is likely that your patient has LVH. Now, AVL, slur NEC, 1 AVL. We're talking about AVL, right? AVL, if the R wave, the tallest portion in the complex, if the R wave is greater than or equal to 11 millimeters, it is likely that your patient has LVH, or left ventricular hypertrophy. And lastly, slur NEC, 1 AVL feet, right? AVF, we're looking from the feet, right? If the R wave in AVF is greater than or equal to 20 millimeters, it is likely that your patient has LVH. So really quickly, septal S plus lateral R greater than 35 millimeters. Any chest lead greater than 45 millimeters. The R wave in lead 1 is it greater than 12 millimeters. The R wave in AVL is it greater than 11 millimeters. If the R wave in AVF, if it's greater than 20 millimeters, these are the only 5 questions that you need to ask to determine if your patient has left ventricular hypertrophy. I hope that you find this information useful, and remember to like and subscribe for more content.